Hi everyone, my name is Chelsea and the topic that I chose to research is prescription drug abuse. So in this presentation, I'll be going over what exactly prescription drug abuse is, statistics and facts, its effect on public health, and a final takeaway. So what exactly is prescription drug abuse? In general, prescription drug abuse is the ingestion of prescription drugs in any way that isn't prescribed by the prescriber. This can include taking the medication for a different reason than prescribed, such as getting high, taking the medication more than prescribed by taking multiple doses at one time, or taking a medication that was prescribed for someone else through the help of the patient or fraudulent prescriptions. Now, within a pharmacy, there are multiple categories of medications based on their ingredients, usage, and potential for addiction. These categories include GSLs, which stands for General Sales List medications that have few restrictions. Some examples include allergy medications and laxatives. Pharmacy medicines are medications that can only be purchased from behind the pharmacy counter but do not require a doctor's prescription. Examples include Sudafed, Claritin D, and Aleve D. In this presentation, however, we will be focusing primarily on the last two categories, which are prescription-only medications and controlled medications. Prescription-only medications require a prescription from a doctor and include medications such as atorvastatin, lisinopril, and levothyroxine. Controlled drugs are medications that have a high potential for addiction. Within the category of controlled medications available in a pharmacy are schedules of drugs that are organized by their danger and potential for abuse, with Schedule 2 drugs having the highest potential and Schedule 5 having the lowest. Some examples are Adderall, oxycodone, and morphine. Now that we are familiar with the concept of prescription drug abuse, let's look at some statistics and facts that make it a public health issue that has unfortunately reached an epidemic level. In America, more than 115 people die from a prescription drug overdose nearly every day. As time has passed, the amount of emergency room visits and deaths that were associated with prescription drug abuse has increased exponentially. Now, as seen in the figure presented from the National Institute on Drug Abuse, between the years of 2010 and 2017, overdose deaths including opioids, one of the most abused prescription drugs, more than doubled from 21,089 to 47,600. Between the years of 2017 and 2020, the amount of deaths increased to 68,630. When looking at general demographics, males are more likely to die from a prescription drug overdose. However, prescription drug abuse is rising at an alarming rate in females, as nearly 18 females lose their lives to prescription drug abuse daily. Prescription drugs are among the top 3 substances that are most abused after marijuana and cocaine. As shown in the figure presented, opioid, painkillers, and central nervous system stimulants are among the top categories of medications abused. Those within the age group of 18 to 25 years old are by far the most vulnerable to falling into cycles of prescription drug abuse. 6% of Americans over the age of 12 abuse prescriptions, and over 70% of these prescription drug addicts are addicted to opioid painkillers, making it the most abused type of prescription drug. When patients are dealing with chronic pain, they are most often prescribed opioid painkillers and remain on the prescription for a majority of their lives. When these medications are taken as directed, one's quality of life is undoubtedly boosted. Pain is relieved for a period of time, and mood can be slightly affected. However, being on these medications for an extended period of time greatly increases the chances of addiction and, in turn, abuse. Additionally, the interactions that opioid medications have with other common medications and substances, such as those that affect the central nervous system, are potentially fatal. Breathing is highly compromised, as well as mechanical and mental function. After opioids, central nervous system drugs are second most abused. Millions of people across the population use CNS depressants to treat a variety of disorders such as sleep disorders, ADHD, and anxiety. Taking these types of drugs affects a neurotransmitter in the brain called GABA, which in turn makes a person calm and sometimes drowsy. After being on these medications for an extended period of time, the dosage must gradually increase as the person's system eventually gets used to the effects and requires a more potent form of the drug in order to achieve the same effects. As mentioned before, prescription drugs can have horrible withdrawal effects. As for CNS depressants, withdrawal symptoms can be fatal, including seizures and irregular heartbeat. Now let's look at the effect that prescription drug abuse has on public health. The misuse of prescription drugs can drastically affect how one's brain functions, in turn affecting their mental health, physical health, and the health of their relationships with their loved ones. Due to the pure strength of these prescription drugs, one's self-control, decision-making, and overall conscience is affected. As a whole, prescription drugs are not assigned as bad a stigma as illegal drugs. Prescription drugs are seen as safer, more controlled, and in a way, good for one's health. As a result, we often don't take into account the dangers that can come with prescription drug usage. As most prescription drugs must be taken on a certain schedule, it is hard to realize that one is becoming addicted to the substance until a dosage is missed or the treatment stops. Now, as a community, there are some things that we can do in order to slow the rate of prescription drug abuse. In order to ensure that the prescription drugs don't get into the wrong hands, they should be properly disposed of. Safe drug drop-off locations should be made more known and accessible to the general public, as well as information on how to properly store and keep track of potentially dangerous medications. Rehabilitation programs should be made more approachable to those who want to take the first step to ending their abuse cycle. Additionally, programs similar to Alcoholics Anonymous, or AA, can be made more accessible to those that benefit from support groups or who just need someone to talk to. Overall, prescription drug abuse is a public health issue that should not be taken as lightly as it currently is. With the rate that prescription drug abuse is increasing, much more awareness about its symptoms and impacts needs to be spread, especially in schools, as adolescents are the most vulnerable age group to the cycle of abuse. In addition, more research about the long-term effects of prescription drug abuse should be done, as it is quite common for patients to be on potentially addictive medications for a majority of their lives. Thank you so much.